What tiny abnormalities can cystoscopy find in the prostate? Imagine peering inside the urinary tract to uncover clues about prostate health. Cystoscopy is a procedure that uses a thin, lighted tube called a cystoscope to look inside the urethra and bladder. While it mainly examines the urinary system, it can also reveal small changes related to the prostate. Since the urethra passes through the prostate gland, any abnormalities affecting this area can sometimes be seen during cystoscopy. One common tiny abnormality is urethral strictures or narrowing. These are small areas where the urethra becomes constricted, often due to scarring or pressure from an enlarged prostate. During cystoscopy, a doctor might notice a reduced or pinched urethral opening, which can cause difficulty urinating. This narrowing can be a sign of benign prostatic hyperplasia or other issues compressing the urethra. Cystoscopy can also show signs of benign prostatic hyperplasia, or BPH, which is an enlarged prostate. While it does not directly image the prostate tissue, it can reveal secondary effects like bulging or irregularities in the urethral while caused by the enlarged gland. These changes can make the urethra appear distorted or compressed, giving clues about prostate size and shape. Inflammation or irritation near the prostatic urethra is another tiny abnormality that cystoscopy can detect. Redness, swelling, or small lesions in the lining of the urethra may indicate prostatitis, which is inflammation of the prostate. These signs can help doctors identify infections or inflammation that might be causing urinary symptoms. In some cases, cystoscopy might reveal abnormal tissue growths or lesions near the bladder neck or prostatic urethra. While rare, these could be signs of tumors or precancerous changes. However, it is important to note that cystoscopy is not primarily used to diagnose prostate cancer, as it cannot visualize the prostate tissue itself in detail. Tiny blood vessels or bleeding points near the prostate area can also be seen during cystoscopy. Small areas of bleeding or abnormal vessels in the urethra or bladder neck might be related to prostate issues or other urinary tract conditions. Overall, cystoscopy provides valuable information about the urinary tract and can indirectly suggest prostate problems by showing changes in the urethra passing through the prostate. It is especially useful for evaluating symptoms like difficulty urinating, blood in the urine, or recurrent infections. If abnormalities are found, additional tests such as blood tests for prostate-specific antigen, imaging scans, or a prostate biopsy may be necessary for a definitive diagnosis. Remember, cystoscopy is a helpful tool for assessing urinary tract health and can reveal tiny abnormalities related to the prostate. However, it is not a direct method for diagnosing prostate cancer. Always consult a healthcare professional for personalized advice and further evaluation if you experience urinary symptoms or have concerns about prostate health.